So welcome to this video blog. This week we're going to talk about the knee. So in the past we talked about low back, carpal tunnel, shoulder. We see a little bit of everything all throughout the body. And some people will come in and have limitation in, let's say, bending their knee. So one simple thing you can do, I'm showing standing, but it can definitely be done seated. You take a towel roll or something equivalent, and you want to basically put it behind the back of the knee. So then you would apply pressure with your arms, and that creates a gapping effect. So when you pull back, you're actually creating a little bit more space between the upper and lower knee joint bones, and it usually feels pretty good. I mean, if there's pain, our main rules are to keep it as safe and pain-free as possible, so don't do it if there's pain, or just try a little bit bulkier device behind the knee. So that's one thing to gain some knee bending. Another thing that works really well is a movement where you can do basically a straight leg raise, where you try to keep your knee as straight as possible, pull your foot towards you, and test, always pre-test each side. So if one side's really good and the side that's bugging you is not as good, it doesn't straighten out as much, doesn't have as much strength, what we find, and through total motion release, is you can do the opposite side where you hold, and keep pushing into the end range for 20 seconds and repeat that twice on the good side, and then immediately recheck what was bad. And most of the time, we find about 75% or more of the people, this will get better within minutes. So that's another device. So you can do just common things you have around the house and use your own body movement. A few other things we use in here. We take a lacrosse ball, which is a very firm ball, and kind of go around the areas that might be just really tight, painful, and they might have trigger points. A lot of them are in the calf, hamstring, and the thigh. And you would find those areas. Once you find them, move the ball across there to loosen up this tissue that's very much adhered down. So you do that for about a minute or so, and then the third part is apply gradually increasing pressure for a minute or so to get a full release. If you need more pressure, you can't get it all from your hands, you put that on those tight, painful areas and use the weight of your body to find that. Once you find it, you'd move on it and then gradually apply pressure. Another thing that we've got from Rogue Fitness are these voodoo bands. So if someone has a lot of swelling around the joint, we'll go, of course, on the skin, but we'd wrap this around above and below the joint. I probably won't do the whole thing, but just to give you an idea. And once it's fully wrapped, then we have a person, now it's nice and stable, and we'll have them move that joint. With that compression, pumps out a lot of the fluid. Then when we release it, they'll not only have less fluid, but usually a better motion and less pain. Another thing we do here is we have our 830 laser, which insurance doesn't pay for, but we get really good results with that as far as reducing pain and inflammation in the knee joint. So like always, if you have any questions or comments, please email or call or stop by. Thank you very much.